Hi, this is Nicolette Lambert with Birth Multiverse, and this is our lecture on pain in labor, or rather, understanding pain in labor and a little bit on how to cope with it. So, for most of us who have been kind of, especially in America, we are primarily familiar with labor as something painful. That's typically how it's represented to us. I want drugs. All the movies, you've seen the movies, and women don't have natural births. They are screaming for drugs, and they're in horrible pain and whatnot. And then sometimes you get kind of the mommy thing going, and women start talking about their births, and they start talking about just the horrible pain and the contractions that were just so awful and things like that. On the other hand, I don't want to present sort of a sugar-coated version of this. I want us to get real about pain in labor and what that means and what it can potentially be, how it could potentially be different. So let's first talk a little bit. Let's get a little bit more general here first. So if you think about it, there are a lot of different types of pain. We're all going to experience pain in different ways. Our bodies experience pain as a result of a lot of different things that it undergoes. So pain in a natural labor, at least, is different than the pain associated with an illness or an accident. So typical example, you put your hand on a hot stove, you feel pain. Well, this is your body's way of telling you to stop doing what you're doing, or you're going to permanently damage your body. You leave your hand on a hot stove, you're going to damage the nerve endings of your hand permanently. When you're sick, you'll feel pain in the affected part of your body, and that's a byproduct of your body trying to heal itself. If you get food poisoning, you're going to your body's going to start responding with nausea and vomiting to purge the bad food and the pathogens that are causing that. If you get strep throat, you're going to have an inflammation in your throat as your body is fighting off that bacterial infection. That inflammation is a byproduct of your body mounting a defense and attacking the pathogen, the bacteria that is causing that strep throat. Now, if you're in an accident, you're going to feel pain because your body's tissues have been disrupted in an unnatural sort of way, like a serious cut or broken bone. We're not meant to walk around with deep gushing wounds or broken bones, so destroying these tissues is going to cause pain. But labor pain is different because childbirth is a natural part of the female reproductive or just the female biological life cycle. Giving birth is part of what all organisms, reproduction is part of what all organisms are here to do, and for us humans, that's giving birth, and it's a natural part of our biology. So if you're feeling pain in labor, that doesn't necessarily mean that something is wrong, and often we're programmed to think that if there's pain, that means that there's something wrong. So what I want you to do is actually shift from this idea that labor is is an illness of some kind, to seeing it in a little different way. The closest parallel actually to pain in labor is actually a workout. If you've ever done a workout, you know that can be painful. So contractions are just that. They're contractions. The uterus is a muscle, and that muscle contracts and releases as it pushes the baby out. So contract and release to push the baby out. And it's doing this over and over and over again, and that's hard work. And your muscles work hard, they hurt. If you've ever done a major workout, you are familiar with this. So think of it like weightlifting. It's a workout, not an illness or an accident, at least if everything is going properly, and which most labors are natural and there's nothing serious going on. If you do a series of push-ups or sit-ups, your muscles will contract and release over and over again as you do the exercises. Now, with push-ups, those muscles that are doing the contracting and releasing are your pectorals. If you are doing sit-ups or crunches, it's your abs. And in labor, it's your uterus that is doing the workout. If you've ever done a major workout, again, you know that it can hurt, and but you also know that if your form and technique are correct, you can avoid injury. And this is another very important parallel, because if you are in labor and you are laboring in kind of an unnatural position, you've been forced into like a position that you're not comfortable with, or that doesn't work for you and your baby, then yeah, you're going to experience an unnatural amount of pain. However, if you are able to be in the position that you need to be in, you're moving around, you're able to just be in the position that you need to be in, that's going to reduce your chances of that unnatural pain that's associated with injury. Now, there are some women who report not feeling pain in labor. We're going to give them, again, in the nature of trying to give this discussion a fair trial on all points, we're going to talk about the women who say that they don't feel pain in labor. Typically these women characterize labor as being a sensation of the contractions as having a sensation of pressure and release, rather than being painful. Now, there are some anecdotal accounts of women who were in a very, very relaxed state when they gave birth, and they claim they don't feel pain. And so I can't really comment on these women's experiences, because I've only experienced labor in my particular way. But I think that these accounts are interesting, and that they are indicators that labor doesn't necessarily have to be traumatic and overwhelmingly painful. I can tell you that when I gave birth, probably my most painful one was with my son, where I was laboring in a position, when I delivered him, I was in a position that really wasn't very comfortable for me, and I had some tearing, and that added extra pain. With my second two, I labored in the position that I really wanted to be in, and that helped reduce that. I didn't have the major tearing, and it helped reduce the pain. And I will say that in many ways, it is a very intense experience, and there's a lot of pressure, and I did feel pain, but it's just a very intense experience. I think is ultimately the way I characterize labor, is not necessarily pain, but just intensity. You're getting pushed to the limit. You're really, again, I compare labor to a marathon, and it's like the marathon of it's the marathon of the female reproductive system. So there's pain. What are we going to do about it? Well, we're going to talk about a few different methods of coping with pain in labor, and in the other lectures we're going to get a little more detail, get into the nitty-gritty of ways that you can cope with pain and have pain relief during labor. But before we do that, I want to talk about something that is really super cool that you probably haven't heard about before, and that is that your body already has some natural pain management built in. So you may not have heard this. You kind of we are typically kind of presented with the idea that our bodies are incapable of handling the pain in labor, and there's nothing that we've been equipped with to even help us with that. Not true at all. You have one autopilot pain relief coping mechanism. It's called beta endorphins. So beta endorphins are hormones that act as a pain blocker. They are also what create that sort of million miles away feeling in labor. So that's why, and think about this it's pretty interesting this way. That million miles away feeling that you get in labor doesn't kick in until the contractions start kicking up in intensity, as you're progressing further and further into labor. But on the other hand, you also don't get that million miles away sort of a feeling in labor until you're really far along. So what your body really is doing is, as the contractions get stronger, get more forceful, even get more painful, then your body starts releasing those beta endorphins in higher amounts to help you cope with that. And again, this is all on autopilot, and especially if you're able to labor in a setting where you feel relaxed and you're able to have to let those hormones that your body has in labor just kind of do their thing. Now, ironically enough, pain medication in labor actually decreases as beta endorphin levels. So that is one thing to keep in mind as you're making your decisions about how you're going to handle labor and pain in labor, is there are trade-offs that if you get pain medication, you will decrease the level of beta endorphins that your body is experiencing. Dr. Sarah Buckley has talked about beta endorphin levels and that they act as kind of a rationing factor in labor. Now, again, here we go with how your body is kind of on autopilot with this and just adjusts as needed. So high levels of beta endorphins can slow down labor by increasing oxytocin. You remember we've talked a little about oxytocin. Oxytocin is that so-called love hormone. You feel oxytocin when you have skin-to-skin contact. Couples who are in love have lots of oxytocin. Breastfeeding causes oxytocin is what causes the letdown in breastfeeding. And it also oxytocin is also one of those labor kickstarters. So if your labor starts to be too intense, then what your body can do is increase the oxytocin by decreasing the level of beta endorphins. And this may be a way of helping to kind of adjust the intensity of labor according to your ability to deal with it. So if labor starts becoming too intense, your body kicks up those beta endorphins to slow things down and help you deal with it better. And again, this is pretty cool. Your body is built to handle labor. Your body is built to handle labor even if there are no pain medications or anything else around. So pretty cool. Remember that our bodies are amazing. They are built for labor. And this is the end of our Understanding Pain in Labor lecture. Hope you learned some really great stuff and that it has kind of shifted the way that you think about our bodies in labor.